So with that, I'll ask Sian to introduce herself, and then we'll get started learning about the Integrative Health and Wellness Center here at UC.
Good morning, everybody. My name is Sian. I'm a professor in the Department of Family and Community Medicine here at the College of Medicine. I'm the founding director of both the UC Center for Integrative Health and Wellness, which we'll talk about today, and UC Health Integrative Medicine Clinical Program. So I'm delighted to be here. I was asked to provide sort of an overview on the center, so I'm so excited that we have such a diverse group of people here, and I'm looking for connectors and collaborators that I think you are as well. So with that, I will get us started. Very briefly, the problem that you all know about, there are two primary problems that the center focuses on. Our crisis of chronic disease, both physical and mental. What we don't talk about as much, particularly in medical school, is that many of these chronic diseases, as all of you know, are heavily influenced by behaviors and lifestyle. So we continue to have a healthcare system that focuses on disease management at a very costly tune. And we continue, at least from the medical school side and other students, training our students on interventions related to things like food, exercise, and movement. And as we know, many of these things like heart disease, cancer, obesity, hypertension are in large part preventable. The second primary problem is our opioid crisis. Many of you know this statistic, but 80% of the global opioid supply is consumed in the United States. We continue again to have a healthcare system that doesn't embrace non-pharmacologic therapies that we know have good evidence. So we're an over-medicated country, in large part because our payers and our insurers pay for this, but there are so many non-pharmacologic options that we know we should be bringing to our patients and teaching our students. So the center's vision and mission are really to be transformational leaders in the area of integrative health and wellness, and I will define what I mean by that. Certainly our pillars of research, education, and clinical, we feel very strongly, as many of you do, about community engagement focused on these efforts. So really, the purpose of the center is to work to shift the system of disease care, disease management to care, with a full foundation on concepts of how we eat, how we move, how we manage our stress, and how we connect with the world around us. We all know the data on loneliness and connection, whether it be physically, spiritually, in nature, are really at the foundations of health and wellness, and this is based in hard science. So from a structural standpoint, because it can get sort of confusing, again, the center lives within the College of Medicine. We have many clinical departments that you know about, basic science departments. We have 3 institutes, Heart, Lung, and Vascular, our Cancer Institute, and our beautiful Neuroscience Institute. We are the one center. It is a home for the various activities that we do. And so the center is comprised of UC Health Integrative Medicine, our clinical program, established in 2012. And then the academic portions of our program live in the Division of Integrative Medicine here at the Department of Family and Community Medicine, established in 2014. So the center is really the umbrella home for these various activities. From a concept standpoint, my goal was never to create sort of a center that you had to go over to. So this is not a physical center. This is really about creating a wellness platform to support everything that we do. We do a lot of things actually with our West Campus partners, particularly in the mind body space. But this I'm just showing you from the Academic Health Center. Let's make our Cancer Institute, our Cancer Center, the best it can be. Let's make our Drake Rehab Center the best it can be by creating a foundation of wellness. We've got about 30 affiliated faculty. We're interested in others joining us. These are faculty from our 4 health colleges across 12 departments, the VA and children. And these are all faculty. Good morning, whoever just called in. These are faculty and staff who really are adhering to these same concepts, whether it be in their clinical care, whether it be in their education, whether it be in their research. I would like to show you this map. So we are part, as many of you know, we have about 150 medical schools in the country. 75 are now part of an academic consortium for integrative medicine and health. So we were the 46th schools joined in 2009. These are our collaborators and partners and my partners across the country. This is Duke and UCSF and Harvard and Stanford. These are all the other academic health centers that are building integrated medicine bases, whether it be clinical programs, education programs, research. So these are wonderful partners, and I'm going to tell you about a conference. Everyone's coming to Cleveland actually a year from now that I'll show you. What are the different codes? That's a good question. I don't know the answer. I'll come back and that's a good one. So what is integrated integrative medicine, what is it? What is it? So the definition I like to use is that integrative medicine is really just good medicine. It combines conventional medicine, which we do a great job at, with evidence-based complementary therapies with a heavy focus on healthy lifestyle, addressing stress, nutrition, movement, sleep, and environment to reduce suffering and promote overall wellness. Again, for those folks, probably everybody on the phone is familiar with our National Institutes of Health. We have about 27 institutes. We have a smaller budget we call a center. So we have a national center that used to be called Complementary and Alternative Medicine, NCAM. 2 years ago, we switched to Complementary and Integrative Health. We got rid of alternative. There's nothing alternative about it. And we replaced medicine with health. But these are certainly some of the areas that we think about from a non-pharmacologic-based therapy perspective that we're working on bringing in here to UC Health. Movement-based therapies like yoga, mind-body therapies like acupuncture and mindfulness, expressive therapies like music and art, body-based therapies, massage therapy, and energy therapies, things like healing touch or Reiki.
I should know the answer to this. Do the centers have to sit within an institute, or can they sit?
No, they
separately?
sit separately, and in fact, what's interesting is they sit separately. I think we have a National Center for Health Disparities. They just have a smaller budget. They're not within an big, a smaller budget. But what's most interesting is the majority of integrative health research in this country gets funded outside of this center because it's got a smaller budget.
Yeah.
The National Institutes of Aging, our NIMH, our Mental Health Institute, our Cancer Institute actually funds the majority of research in this space.
The centers at NIH.
The center is the institutes at NIH, yes, the bigger one. So integrative healthcare from a clinical, what does it look like? It means not just treating people with medications. Believe me, I take them when I need them, but it means introducing things like acupuncture to treat pain. Instead of just treating stress and anxiety with Lectureship, which again, I've taken myself, what about mindfulness-based stress reduction? And where do we treat heart disease in this country? We treat it in the operating room to the tune of a lot of money, as opposed to getting ahead of the curve as much as we can, helping people with healthy lifestyle in terms of food and exercise. So UC Health Integrative Medicine is primarily small and ambulatory at the moment. We're growing our inpatient presence. We have integrative functional medicine physician consults. Dr. Chaudhry, several of you know, does integrative oncology consults out at Westchester. We have acupuncture, massage therapists. We have a wonderful psychologist, Barbara Walker, who does all the traditional stuff, but she does biofeedback and mindfulness. Just this year, we've introduced Tai Chi and yoga, mindfulness-based stress reduction, integrative health group visits with Dr. Tiff Beers, and infusion suite services, which I'm going to dig a little bit into. I am most proud that we are the first health system in Cincinnati to have a full-time acupuncturist, Eric Johnson. We are currently hiring 2 additional full-time acupuncturists for UC Health to serve our Cancer Institute, Neuroscience, and Women's Center. But I'm most proud that we've worked with our insurers to now be covered under 8 insurance plans by a licensed acupuncturist. The state of Ohio is only the 2nd state in the country, second to California, that's leading, and UC Health is certainly leading, which basically, as you all know, opens up access for tens of thousands of people. We finally have movement-based classes. It's been primarily an issue of space on this wonderful campus that is just squished, as all of your campuses are. Our beautiful Neuroscience Institute, I worked with the architects early on to have a wonderful room that we can now do yoga for patients with MS and other neurologic conditions. It's launched. We also have a Tai Chi class that is open to students, faculty, associates, anybody. It's $5 a pop. It's with our acupuncturist. He's a master Tai Chi and medical Qigong expert. So we're very excited to have movement-based. There's Derek, actually, our acupuncturist on the left. We are expanding infusion suite services. So we've got 4 cancer infusion suites. We also have 1 for multiple sclerosis. Our goal here is to go in, and when patients and families are sitting there for long times, 4 hours, 6 hours, 8 hours, we have some wonderful therapists that go in. They're yoga therapists by training, but they do relaxation, guided meditation, imagery, just to really create comfort, relaxation, and reduce suffering for patients, which is one of the goals of our health system. We are dipping into the energy therapy space. I told Dr. Vogt and my board on Sunday, we didn't start there, but we have a wonderful nurse, Elizabeth Rieskamp, who's a trained healing touch provider. You know, Children's has had this for years. Cincinnati TriHealth. Our senior leadership of inpatient is open to us trialing this in our medical ICU. So we're just starting to dip our toe in with really providing comfort and inducing the relaxation response. So that's an exciting kind of new foray for us. I know I'm going quick, but I'm trying to do a sort of an overview. We have a variety of research. I would say this is the area that we need more sort of collaborations and connections with. It's just a matter of time and energy for us. But we work closely with Dr. Del Bello in psychiatry, looking at a mindfulness-based cognitive therapy intervention for children at risk for bipolar disorder. We've worked with Sid Khosla and ENT in the community doing music therapy projects for at-risk youth. And we've worked with children to look at some of their integrative therapies for pain for children in the hospital. I would say a lot of what we do, particularly on the research but program side, is around resilience and reducing stress and managing stress. We all know the physician burnout data, the faculty burnout, the student burnout. So a lot of what we do focuses in this space. One of the research things I'm particularly excited about is we have been looking at the mental health of our medical students over 3 years. You can see we've worked with student affairs and basically collected data on over 700 medical students every year. And so we're looking at a longitudinal picture of how do our medical students look. We actually are in discussion with the dean of TCN to do the same for his students. And I would say if I were to share briefly with you the data, it's kind of scary. Our incoming students, and this is not different than national data, but I wanted data for our school. Say, what can we do? The incoming students, they come into medical school and they're looking pretty good. You know, they look pretty good, and then they get into medical school. And over the first 2 years, their burnout scores, anxiety, sleep, fatigue, depression get worse. They become less empathic, which is just really sad for training medical students. They recover a little bit in the 3rd year, but not significantly. And over the 3 years, they're more stressed, they become more callous, which is one of the burnout items. Their affect, positive affect goes down, and their resilience goes down. So we're hoping to use these data to really feed programs now. One of the programs I'm so excited about is the Mind Body Skills program. This is a 9-week program that it's a course that's just a elective. We developed it from Georgetown University School of Medicine. We've had 400 students participate at 10 of our colleges. So we're at TCN, we're at the law school, we're at Dept, we're at all 4 of our health colleges here. But the concept is to teach our students early on around self-awareness and self-care, utilizing mind-body tools. Things like biofeedback, forgiveness meditations, drawings, journaling. And it's a fantastic program that we've trained over 70 faculty across the university. It's a wonderful example, I think, of a cross-university collaboration. The grant from Interact for Health ends this year, so I am actively negotiating with the provost's office to see if they will pick it up. Because what you see is students that take the 9-week course compared to their peers, they do better. After the 9 weeks, they've got better mindfulness, increased empathy, they're more resilient, their affect's better, stress goes down, their negative affect goes down. So it's a program that works. And I think it's a program, it's interesting when you look at the data, I can't do a deep dive today. You know, the control students, the students who don't take the course, their affect is just tanking. And it's not as if the mind-body students are great, but it's as if it mitigates the impact. And our mind-body students just kind of stay steady. So we're very excited about this program in particular. We have a research collaboration, Karina Broidigan, if anybody knows her at Children's, she's an integrative oncologist. She takes care of kids with cancer when they're in the hospital. And her passion has been, we have to reteach children in a healthy way. So we work on the research side. She has a wonderful program called Build It Bites, where she goes to both Turner Farms Teaching Kitchen and the Finley Market Teaching Kitchen, and she teaches kids about the benefits of food in a healthy, fun way. And these are some medical students on the left. We help her from a research side to collect that outcome. Anybody who's interested sort of in this area in particular, next year in Cleveland, so we have our International Congress on Integrative Medicine Health. It is the scientific meeting globally. It goes off North America's campus every other year. We happen to have it in Cleveland next April. I happen to be the co-chair along with Gloria from Harvard. It's 1,000 people from 40 countries. Really, this is the top science, but there's educators there, clinicians. Happy to send this to anybody, but we'd love to see anybody there. The call for abstracts is due kind of the first week of October, but this is their go-to. If I pivot a little to education, my goodness, Kelly Lyle, who many of you know, is extraordinary. So she helped us launch an integrated health certificate. The certificate is made up of 5 foundational courses, 2 of which are new: Fundamentals of Integrative Health and Medicine, which we now teach out of the college, and the Science and Practice of Mind-Body Medicine, which we teach out of here. And then there's 3 additional courses: Personal Nutrition with Sarah Couch's group at Allied Health, General Exercise Physiology with Dan Carl's group from Allied Health, and Positive Psychology
Nonpharmacology. Barbara Walker from Arts and Sciences. So we're very excited to have launched this just this year. That took a lot. Here's just a picture. You know, these actually happen to be people taking our two first new courses. These are Emil Menon Med Science undergrad. The courses filled and had waitlisted. We've gone from 30 students to 45 to 55, and I have waitlists already. We've only run this course 3 times. So we're looking forward to really expanding significantly the educational offerings of the center over the next few years. I do want people to know once a year we bring an absolute expert in mind-body medicine because of an endowed lectureship. All the first and second year medical students come. It's open to anybody. It's open to all your students and yourselves as well. Dr. Peter Wayne comes to us Wednesday, October 6th at noon. He is currently the interim director of the Osher Center for Integrative Medicine at Harvard University. So really one of the stellar programs, if not the in the country. And he's also been the research director for a long time. So he's an extraordinary researcher, probably the best internationally on Tai Chi and medical Qigong. So at noon is his lecture in Kresge Auditorium. We'd love to have any of you there. He's also doing an experiential session, a Masterclass from 4 to 5 on the Tuesday before. We've got the whole auditorium at UCCIHW, and he can do a Masterclass on Tai Chi and medical Qigong. He's had his own studio up in Boston for 5 years, and if anybody's interested, he's an extraordinary guy. Tuesday session for chiropractic? Yes. Just let us know because we've already got 55 students coming. We can hold 100 in the room. So yes, there's an RSVP at UC.edu, just to let us know.
So this group particularly here, we reach out into the community quite a bit. And Sue Schmidt, participating from Xavier, obviously they have a lot of potential students. It's open to all comers?
It's open to all comers. So the Tai Chi session from that 4 to 5, the auditorium at UCCIHW could only hold 100 people. We've already got 55 students coming. So
Okay.
Once we get the next 45, we'll have to cap it off. Kresge Auditorium for the noon lecture. If there's anybody on the call that wants to bring kind of a group of students, just let me know so I know we have enough room. We have about 500 seats in Kresge. About 350 will be full already. But if you have groups of 30 students you want to come, just email me or Lisa and say, do you have room for 30? And I'll make sure that we kind of section off the section upstairs.
Okay.
Yeah, thank you. So
Are these things being recorded?
we always record the Kresge. That's an interesting fact. Yeah, we always record the lecture, which can then be seen at another time. So the new Wednesday lecture will be recorded. And all of our previous ones are on our website.
Okay,
Yeah.
excellent. Thank you.
So if I pivot a little to the community, we are so excited this year to be working with Meredith McGraw. She's a former program officer for Interact for Health, working half-time with Nancy Miller and 1 in 5, half-time with us. We just launched Mindfulness in the Workplace. We do have our first client. It's a major corporation in town. We're just launching off. The goal here is to be able to go into major businesses, corporations, small businesses, and offer mindfulness and resilience training. Aetna does it, Google does it, everyone around the country does it. Meredith and I have worked for 2 years, and she said, Sean, we can develop this here. We've developed a great program. So we're interested in kind of our first adopters for this. She makes it quick, easy, goes into the businesses. I'm excited to have Meredith with us. We do a lot with Turner Farm, the beautiful organic educational working farm in Indian Hill. We take groups of medical students, nursing students, pharmacy students out for kind of Saturday retreats. The goal there is not just to have a lovely Saturday, but to introduce the concepts of food, mindfulness, and these things early on to our students. We also do a community wellness series out at the farm, and we bring our academic experts out. So Dr. Colapietro from neurology speaks on the mind diet for brain health. Preeti is a fabulous functional dietitian, speaks on weight and wellness. Dr. Nari Mandial, she calls herself the food doctor. These are the scientific talks on gut health, but then people can ask questions. They get into the kitchen, they cook a fabulous lunch with Chef Stephanie. One of the programs I'm so proud about, really thankful to the Sanvi family, is that we have brought mindfulness-based stress reduction finally to the city of Cincinnati. This is John Kabat-Zinn's course out of UMass, 30 years of data. We've never had people in Cincinnati train. We now have a wonderful community course that I hear are going to be joining us. Our community course is open to the community. It's hosted at the Breathing Room, Bryanville. But importantly, we take it down to our Free-Store Food Bank, to our Cincinnati Cooks program, which is a fabulous program that some of you may know about. It's for people with histories of homelessness, incarceration, and the second chance part of it, they learn to be line chefs, and we do the MBSR program with them down there. So, again, here's our community course if anybody's interested. It's not a drop-in, it's not come in for 30 minutes, this is an 8-week course, but the data behind it is strong, and our 2 instructors are fantastic. Oh, and students, I'm offering to students for $100. It's $450 for community members, $400 if you're UC, but it's 30 hours of teaching time with an expert. Any student can come for $100. We are going to add this though as a course. We're going to bring the MBSR formally as a course in the medical school next spring, so that we can really increase access to our students.
Yeah, of course, for students to learn, do NBS, do this mindfulness themselves, or is it to teach them how to teach?
So it's to learn themselves. This is a deep dive experiential where they're learning it themselves. To become an MBSR instructor, it is 4 years. I mean, the training is super expensive for themselves. We do a community symposium every year. We've done this annually. This last year we did it over at Tangeman. It's a wonderful day where we bring the science of wellness forward with a lot of experientials. I would say that save the date. We've just set our date for a year from now, Saturday, October 17th. We're going to do another Integrative Health Symposium. We're collaborating with Survivorship, focus on integrative health and cancer and wellness. And so it will be at our Kings Peak Marriott that's just been sold, and it's now at the Graduate, so it's going to be on East Campus. We're looking for people to join us. So if anyone's excited, there'll probably be 350 people there. Every year we sell out. It's just a wonderful day of experiential. So I went quick. I wanted to try and get through it. I would say, these are some pictures. You can't see Max over there. Max Raphael, we just had a beautiful event on Saturday. He does singing bowls. There's Derek doing Tai Chi. We're interested in collaborators, connectors. Come join us. We have a big initiative here to Cincinnati. I think we can do it out of our academic health center, and I appreciate the opportunity. That's just our main website. You can sign up for our kind of e-newsletter. You can become a friend of the center. You can volunteer, find ways to engage. So with that, I will stop and thank you for the opportunity.
I have like 3 pages of questions, but I'm going to go. I'm going to open up for discussion, comments, questions, thoughts, connections. I have to say, we gave Sean 20 minutes. She had about an hour's worth of material, and she crammed it into less than half of that time. So there's a lot here, and most of it is a teaser, but there's ways to get more information. But I'll turn it over to everybody now for comments or questions that anybody has.
Sean, thank you. This is fabulous. I have to say, I've heard your name a lot. I always thought you were a man.
Not fan. But we're not.
Sean is a lot of things.
Yes.
Okay, never.
So my areas of interest are cancer, older adults, and end of life, and brand new alcohol use during. So what kind of data do you? So I have 2 things. What kind of data do you collect in just like pre and post your programs? And do you by any chance have a survey that evaluates lifestyle?
Thank you, Carmen. So before and after, it depends on the programs that we're evaluating, right? So we do a lot of things, as you saw, in kind of the mindfulness stress reduction space. So we're typically looking at some of the measures we saw. We look at some of the positive signs, resilience, mindfulness, empathy, but we also use the promise, short forms for things like fatigue and depression and related affect. So it just depends on which program we're evaluating. For any of our clinical activities, we're building in, basically, we look at pain and stress on an ongoing level for kind of our clinical. The majority of our practitioners will say their goal is to reduce your pain and stress. We usually use the perceived stress scale, the 4-item one. I've used the longer one, but given in a clinical setting, we usually use the PSS-4. I'm open to any suggestions, but that is the one. In terms of measuring lifestyle, that might be another thing we might discuss. I don't know if you're talking about general lifestyle.
No, actually, lifestyle behaviors are can be changed. Yeah. Exercise, health, illicit drugs, alcohol, issues.
So I be many other people on the call that measure that a lot more than I do. I'm open to learning and listening, but I don't have something off the top of my head. We do a lot of things around lifestyle, but right now, the programs that we evaluate are typically in the mindfulness mind-body space, so they tend to hit the mental health. Wish I had better.
No, that's a perfect answer. So now I need to know I need to look at it.
Yeah.
You weren't.
No, but TCNers, they do a lot of things around lifestyle and behavior within their group business. IERS, may have ideas.
I have two questions, but maybe I'll throw it to the floor first. Do any of our callers have questions? Is that a question?
I'm like a heavy sigh.
Yeah. Chime in if you have a question, but, so I'd like to know if you, well, first of all, if you could send me the announcements for your upcoming events, I can promote them to the TCN. And secondly, are you considering trying to put together an MDSR program
At UC?
in the College of Medicine, College of Allied Health?
Yeah, so mindfulness-based stress coaching, it's an extensive course, but it is the evidence-based. We have it in the community, and anybody can go. Some of our UC faculty are going. Anybody can go to that. It's open to the community.
Oh,
We have our 1 to 3 star food bank. We are going to start it here as a course. Now, I would tell you, we've met with Liz Allman recently, and I've been meeting with Kelly Crandall from UC Health. I would like UC Health and UCHR benefits to pick this up as a benefit for our employees. I've been trying to get them to be first adopters. I've not yet moved the needle, but I would like them to buy in, half this year and say, hey, we'll pay $200 and people only have to pay $200 to come to the table. Anybody who wants to help me manage up, so it will be available as a course. You can sign up and register, but you'd have to sign up as a student and go to the community course. But I'm trying to get our benefits folks to pick it up.
but what would be involved in developing, if not this particular topic, some other form of integrated health or integrated health itself as a.
Oh, sorry.
Yeah,
So
yeah,
that's really, so guess what? I had to take that point out. So we've been recently meeting, we just met on Monday again with Dr. Giller, our Associate Dean for Education in the College of Medicine. And the other thing, many of you know, we are getting close to either an integrative health and we're close to the District University, undergraduate major in integrative health and wellness. We are waiting to see if the provost pick that up. I know they're moving forward with a public health minor and major, and it has now just been. I hope with the provost's approval, and really, when we do that, we're really looking for collaboration across, okay, similar to our integrative certificate. This will be a broad-based, allow the card. Stay tuned. Thank you. Sign up.
Any other questions? Anybody?
Just piggyback off of that, what I think would be really interesting is not necessarily training students to be able to be that 4-year expert, but to understand knowledge works, how it incorporates they could incorporate it in their practice, how to identify them. In social work and in cancer, it is a big thing. Mindfulness cures everything. Right, Art is
Right.
going off saying that. Yeah. So our students would really benefit just from a course to learn about the knowledge, science, practice of it without saying now you go out and practice.
Yeah, so
Now
that
that
is
you know enough about it.
That's exactly what we're developing. So social work students, education students, art students come and say, what's the science behind it? How do I incorporate it both into my personal life, with my own stress, and in my future as a
So because
professional?
our major or minor.
But they could come and teachers, but they could want to take my science and practice and my biomedicine course. Yeah.
Okay. Anybody else on the call before I jump in? Okay,
I will send you a committee.
I'm jumping away. So a couple things occurred to me as you were talking. One is what we know, particularly in underserved areas, that there are a lot of impediments to health, and a lot of it you targeted about being able to get to adequate health care. So it's everything from you know, it's 3 buses and an hour and a half to get to the doctor, another hour and a half to get to the pharmacy, things like so. So it's not just the dollars; it's just general access. One of the things that you were talking and struck me was that what your programs do is provide patients the opportunity to be healthy at home, healthy in their own environment. That the things that you're giving them also gives them access to those skills, resources, whether it's a grocery store or something, but it allows them to short circuit some of the problems, the chronic problems that we see in underserved populations getting healthcare, which is getting to healthcare. So this seems to be something that practitioners can use to allow patients to be healthy at home, healthy in their own environment, healthy for less money, healthy for less need to access resources, pharmacies, testing centers, things like that. So I don't know. It seems to me that you would not miss that. That you would pick up on that. Are you measuring that? But where is it in the big sort of scheme of things that you're looking at? Because you're looking at a lot of things.
We are looking at a lot of things, and my board told me on Sunday we need to go. So,
Fair.
I think we have so many opportunities, and we've been sort of been popping up. No, we're not measuring it.
Okay.
It's a great idea. You know, I think our MBSR program at the Freeze for Food Bank is probably our #1 in terms of a touch point of doing that, going to and bringing things. In terms of measuring, you know, that is a program focused on skill building, which we know isn't good. But I appreciate the question about access and measurement of additional content.
So we're trying to solve the problem of access by having better bus routes, rather than just saying, wait a minute, what if they just didn't need to go there as often? And I also appreciate that your board is saying you can't do 1 million things, you can't do 100 things, can you do 5 things? But one of the unique features about a group like this is you can do 5 things, and a lot of people that are listening to you or would like to glom onto or collect data as an adjunct to what you're doing, they can do another 5 things, and another group can do another 5 things, so that you don't have to spread yourself so thin, but you can accomplish a lot by giving other people access. Because I know, and Sue, I don't know whether you're still on, but I know when we start talking about social determinants of health, we get out into some of those social and environmental things, the access, the other pieces that we are spending a lot of money at overcoming in order to keep our traditional model of medicine alive. And you're doing a sort of short-circuiting that and saying maybe we don't need all of that. But it seems like it fits really well with as a parallel to what a lot of people are trying to do, which is overcoming barriers to access, rather than looking at reducing the need for access.
Sue, did you have a question?
Well, I was just going to support Jack and say, yes, the social determinants of health now, are being recognized as being 80 to 90% of a person's life expectancy, and healthcare delivery is only 10 to 20%. And as you know, the ICD-10 codes are being enhanced by adding social determinants of health to the codes so that primary care providers will start using them and addressing the social determinants of health. Access, you're right, Jack, is a huge issue. And I know at the health department, the Creating Healthy People, Healthy Communities group is addressing access and looking at ways folks can get to care and get the primary care before they're actually ill so they can prevent it, if that helps.
So if they could they can't get to their doctor's office, but they can walk down the street to their church to do Tai Chi.
Yep.
Right.
And so it's a novel, although in my mind, it's a much more efficacious way to address the access issue. It's just move what they need to access closer to them, and without, creating more physicians, simply creating better health closer to them.
Right. And Jack, do you know the CHIP initiative, the Cincinnati Health Improvement Plan?
I know about it, but I don't know much by way of details.
One of the goals of it is access to health care. And so what we're currently thinking about is placing in some of these communities area that a hub kind of thing where the people can walk to get access to care, where interprofessional providers would be located in these areas, including folks that will help them get on their Medicare if they need that, or Medicaid, as well as general checkups and such. And
Right.
if they can't get out, if they're, elderly and they can't get out of their apartment, get telehealth involved. So we are moving. We're trying.
So mostly I'm just saying this to have you think about it, but the other is to let you know that as these other programs like Sue was talking about get up and running, you're probably a more cost-effective ally than some of the other things that they're trying to do. So if you've not been sucked into that, I guess I'm suggesting that somebody needs to do that when you do it. So the other area that always turns a light bulb on in my head, and that is payers. So because that's always been, as we work with improving healthcare, typically the rate limiting step is who will pay for it. And the payers are almost never at the table, often by their own, their own choice. But I'm working on a number of other projects where nationally we are getting the attention of people of Blue Cross, Blue Shield, Anthem, Aetna, that they want to dip their toe into that space, but they also want to have control over how much they get involved with that. So I'm kind of curious about what is your relationship with the payers? Is it one where you've just gotten them to say, yeah, we'll pay for this, or are they at the table somewhere?
Great question. I would like to be at the table with a payer. We're looking for somebody here, and we don't have to. I would say that Joint Commission, as many of you know, they shifted their language specifically around non-pharmacologic therapy. So they used to suggest again, they would credit all of our hospitals, right? They used to suggest non-pharmacologic therapies be available for patients with pain. As of January 1, 2018, the language is now required. A lot of push around the country to say require. Now, hospitals still get to choose what that means, right? That could be some aromatherapy, or that could be something like massage therapy. So hospitals get it. So that, first of all, just from a policy standpoint, is a good move. Now I'm going to the heads of our hospitals and saying, so what are you offering? Tom D, well, I don't know, Sean, it's covered. So we're still at that. What I think is, what I hope, and I'm open to any suggestions from anybody, is what I'd like to do is find a payer in our community who's willing to use their data of X amount of patients that are treated for, you can imagine, X chronic disease, and let's, treat them with an integrated care model compared to a usual care model outcomes. But we need to find that one payer to be able to kind of go off the as you know, once one does, the others do, flipping the model. So I don't have a connection with somebody in particular.
Okay.
Because we have a now major health system that's got a lot of these services, we've got the research capacity really here to look at. Again, our colleagues around the country are both doing, trying to do the same, trying to find someone who's in Boston area.
So this is, what my experience has been that it's a multi-stage issue with payers. One is they won't do anything until you have proof that they will accept, but they're reluctant to help you get the proof. So there's that piece. I'm starting to see tiny little cracks there, but I don't. That looks like a much bigger, harder nut to crack than the second thing I'm finding is once they have decided that a certain thing it will improve health, or for them, will improve their bottom line, then what they are willing to do is develop systems where they use the only data they have, which are billing data, and create dashboards or feedback to individual physicians to help them get to a target with that behavior. So that they seem much more willing to do. They know that, and right now I've got a big national project now with pneumococcal vaccines. So, they've done the math, and they've decided for every X number of elderly that get the vaccine, they save X number of dollars. And so they're very anxious to create systems that press physicians into making sure that these vaccines are done. So that once they get to the point where they see cost savings for them, then they're much more willing to participate at the level of getting practitioners to engage in whatever that is, which I know is sort of a second stage issue for you, because it's one, giving them the proof, but it's secondly, once you have the proof, getting people to actually do it. Yeah.
And here's the third stage, is how do the pharmaceutical companies?
Right.
Oh.
Well,
And they have a lot of input to the providers, I would guess.
not as much as you would think.
That's
Not
good to know.
as much as you would think.
And
mean,
I've
they
had
don't.
so many, to your payer question, Jack, I've had so many people say to me over the years, like, Sean, what's the response to this from the physicians, from the providers? And I'm like, oh, everyone wants it. All they just say to me, but it's not paid for, so I can't prescribe to my patients. I mean, this is the stopgap in the system.
Yeah.
If this is
It's
driven
a
by
chicken and egg
Well, and what
dilemma.
about the
Truly is.
driven by the public.
and the insurance company? What is the relationship there?
So that's actually where the focus gap.
Yeah.
I mean, that is what our academic kind of group is trying to do. Here in New York.
Yeah,
So,
everyone's watching their bottom
I
line.
have-
Pharmaceutical companies are making huge contributions.
So my project is actually funded by pharmaceutical companies to help defray the cost from the payers to develop and produce the dashboards and to parse their data back to physicians to get them to change their behavior.
To get to sell the vaccine. There's a
Well, I mean,
Right.
there's no question, if nobody's gonna do this to lose money, nobody's gonna do this to lose money.
Welcome to my problem.
Yeah. You're not gonna fight pneumonia with
Yeah.
mindfulness.
So I've been working for decades trying to figure out how to get payers to do the right thing.
Well, I'm open to any.
And their definition, what I found is their definition of right thing is not always the same as my definition of right thing. And so finding some compromise or mutual definition is a start, but they've got a big stick. Reimbursement is a huge stick that they already wield in a lot of ways. They're willing to wield it wherever it benefits them. It's just a matter of that, you know, finding that niche. So I've got to get a little bit further in this project, and so that I know who the right people are at the payers, because that's another issue that I found, is they are huge, and figuring out who you have to talk to there is not, and they, I think, purposely obscure. That's, you know, my own paranoia, but I think that they do not make that readily available. So you do have to sort of figure that out. But as this project gets a little bit further along and I have the opportunity to find and talk to the right people, I may ask them what their thoughts are about this space and what they would do if they had in their hands data that said they could make more money. Well,
a lot of these are in therapies.
you know, what we are not good at is econometric modeling. I've seen it. To some extent, I can understand it. I don't have any skills in that, but they live. That's their bread and butter. So if you give them enough of a direction, they will just fire up that skill set that they have, and they'll come back with a lot of different models. It will tell them whether this is worth continuing to talk about. But we don't even know how to go to them and talk about that. We just don't have that. That's not part of what we do. They do it very well and all the time. So I would love to see how to get payers involved in this, because that will really push the spread and dissemination of some of the things that you're doing, because they pay for it.
Yeah. Oh yeah. I'm in.
So, other people out there have some thoughts or suggestions, questions?
We have muted everyone, so if you do have something to say, please be sure you're unmuted.
Yes, you may have to unmute yourself. Like it takes a while for them to figure that out.
I just wanted to share, this is Stephanie. Hi, Sean. Hi, everybody.
Hi, Steph.
I just wanted to share personally, I have used your acupuncture services with Derek, and really, I mean, I think your presentation is awesome. But just personally, just wanted to share that and encourage everybody to utilize it, because when Derek and I were talking, it seemed like pretty much the cancer center or cancer patients and UCCIHW employees were his bread and butter at the time. So shows a lot about mental health on campus as well for faculty and staff. So I would love to help you with HR if you needed some help with that. You had mentioned, Sean, you're trying to push that with the wellness committee. And I think that's a great venue for this as well. So thank you for your efforts is what I wanted to say.
Thank you, Stephanie. It's very kind. Part of our messaging, we were talking earlier of getting messages. So every UC and UC Health employee has their acupuncture services covered. If you have UC Health insurance, it's either a $15 copay or a $20 copay. So getting that message out that we went to our payer relations people early on and said, we're going to sell this, we've got to adopt this ourselves. And just so you know, as a UC or UC Health, if you're covered, that you've got access to those services, and we're expanding those. What I really like to do, again, is to get mindfulness-based stress reduction. Now I'd like to get UC Health to pick up MBSR as kind of the second offering for the team. So I'll take any help you can offer, Stephanie. Thank you.
Where do people all go to schedule?
475 Wellness. 475 Wellness for any of our clinical services. We're also in Epic for anybody who's an Epic provider. You can refer in Epic. Really wanted to create an integrated system so that all of, not whatever, that's actually connected as opposed to
We have a couple of other update things we want to make sure people are aware of. One is, several weeks ago, we started working on a proposal that will senior VP for research about a sort of an umbrella program. I think we have not gotten any additional comments from the set that we got.
We have somebody just had a thing all
Okay,
together yet.
so
And I have a couple of.
we will, all right, we will have another version of that proposal out. And at that point, I think we need to just say, we're gonna stop here. We're gonna start talking to Pat Limbach's office about what they would like to do about funding or something like that.
On that, I talked to Phil Taylor about funding my,
Yes,
class, which I got.
I know you told us that. That's very exciting.
But he has, his budget is completely, all the money going to,
Really?
he was just saying, I have all this money.
Yes, he always says that.
The only money he has is bridge money for people who have a grant that's ending, funded grant that's ended to keep them going while they're in your grant.
Okay, so since we spent the time doing this, here would be my plan. We are now into September, which seems a long way to the next fiscal year. But budgets will, for next fiscal year, will have to start being put together throughout the entire university, starting in about a month. So I want to get this out there, float this as an idea sooner rather than later, and have some discussion. The other thing we know is the president's office is very interested in taking areas of excellence or near excellence and giving them a disproportionate amount of money to make them even more excellent. And that's a change from where the president's office has typically come from, where they like to spread it around.
Mm-hmm.
So I think that they have changed their model of funding. And whenever possible, we like to exploit these new models. So
What is that model?
But isn't that the strategic?
yes, we call it, the president's office calls it strategic sizing, which is a way of saying not everybody gets what they got before, that the good get more and the not so good, they get less.
You can put in.
Good to know.
They had to put in proposals last year, and we're supposed to find out this month which proposals got funded, that they're gonna support.
Yeah.
And proposals have to bring in new money, new dollars.
So we want to at least be on the radar, or at least be aware that that's there, so that we're not taking what we do in an incorrect direction. The other is we're continuing to plan for October 24th on the virtual meeting on mental health. Laura?
We're getting ready to send out the save the date information, and I am looking for speakers. I met with Sharon DeMario, who has many, many connections in the community, who work in this field, and I'm looking for more people from UC, Children's, UC Health, to find speakers for this event. So if anyone has any ideas, please let me know.
Okay.
Any thoughts on suicide?
Okay.
You want to?
Do I have any?
No, not you. Want to include
Yes,
something on suicide?
we've got a couple of people and one organization or two organizations involved, but we really want to separate,
Yeah.
like maybe pick one in that area.
So just
Jennifer,
Right there, and then
Okay.
there's the top of our list.
So
Yeah.
I want to remind everybody that we don't have an infinite number of slots. It's like 4 or 5.
Right.
And we've said that we will hold one for a summary and update from the summit that will be
Well,
held the
they turned us
previous
down,
week.
so they turned us down, so
They don't want to do that?
they don't feel they will be prepared.
I would not disagree with that.
So we're gonna ask Jennifer, and I believe Sue, you've agreed to present as
Okay.
well.
I'll ask.
I think that there are a number of reasons why that's
Yes, I think so too. And, so we really only need hopefully to find 2 more.
okay. All right, we're good. Team Science Basics Workshop is full up plus some, and will be next week. So we're working on that. We have, tomorrow's the last day to register for the CARE conference.
And then if you notice on the screen, Jack, the Population Health Center at Xavier University is hosting a Population Health Conference. That's April 6th, not the 16th. And, because it went out to everybody everybody. I think on the printed versions we have here, but the one that went out to everybody online, that said the 16th, but it is the 6th. And then down at the bottom, James Lee was going to be our next spotlight, but he needs to change that, so that's being rescheduled.
Okay. The diversity cultural competence workshop scheduled for November 15th. Registrations are open for that, right?
I don't think so, no.
Not yet? Okay, so we haven't opened that. So we'll be opening that soon.
That's coming through here.
Yes, yes.
Team science.
Yeah, so we're doing that.
And then next week
and then
is our-
Xavier's Population Health Conference for next April 6th. We're going to keep people alerted to that, so when that gets closer, you'll hear more about it. So things are moving forward in a number of different areas, and I, want to make sure, particularly, that we finish up things with the mental health conference, and we will hopefully have all those slots filled. So I think we are on target for doing a number of things. We are also we're continuing to build the compendium of research training available to all. We have, over 100, we still have over 100 different
130.
130 different offerings. We're going to catalog them and make them available on the CCTSD website, and
now we
will
can-
be able to.
Now we can include the integrated health program.
Yes.
Yay!
Do that. Yeah.
I also wanted to point out, I forgot to mention, with the virtual meeting on mental health, it's now the virtual meeting on mental and behavioral health. And we are again, as we did with aging, we're going to encourage people to meet in pods. So if your department, Carlin, wants to get a conference room together and invite all your colleagues to join you there so that we can have a really big showing and get lots of ideas flowing on this topic. Thank you.
Okay, great, excellent.
Thank you.
John, thank you so much for your time.
Thank you, Sean.
Oh, thank you for coming. Always nice to meet you.
Wonderful.
Thanks, everybody. Nice to meet you.
I'm so glad you're.
Okay.
Thank you. Bye-bye.
Get a hold of me and
That's really helpful.
involved in our cancer.
Yeah.
Okay. Take care, everybody.
All right, thank you all.
The benefits of my job, we're interviewing a new massage